straight. Perfect. All kind of confusion.
I'm just going to be a rag doll.
That's perfect. Awesome. So coming up a little bit higher on this side. Great. And then let's go ahead. I might be sit up facing that way.
My lower back, and I don't know how.
Okay.
My lower back hyperextends.
Okay.
So I, like, anytime that I'm standing for a really long period of time, like, I'll be in a lot of pain.
Okay.
Which obviously I haven't been doing right now, but I was working out, and then I think it was like minorly tweaked.
Okay.
And then I think I dropped my phone in the toilet, and I like quickly went to get it out, so I think I just like fucked it up.
Okay.
Doing that.
Would you say that was like the big onset of the pain? Okay.
Yes. Like I was in bed for the rest of the weekend.
Get all that free time, alone time.
I love alone time. Okay.
The first thing I'm going to have you do is kick out the left leg. And does that aggravate the back at all?
I can feel it in my back, but it's not like crazy pain.
Okay. And then if you pull the toes back towards you? No? So holding that there, if you bring your chin down to your chest. And then big slouch forward. Just big slump into that.
No.
Okay. And then same thing over to the right. Pull the toes back and big slouch.
No.
No. Cool. But you said you kind of felt it a little bit when you kicked out the left leg?
Yeah.
Okay. So let's go ahead and stand on up. Okay. And then if we rotate to the left and back.
No.
Okay. Let's go ahead and slowly run down, touch the toes. As you do that, I'm going to look down the back. So nice and slow.
I can feel it, yeah.
Okay. So you're feeling it all in that range?
Yeah, it's like right there.
Okay. Is that more so on the right side?
I think so, yeah.
Okay. If you slowly go ahead and come on up without using the hands, does that aggravate anything more so?
It's like right here that I can feel it.
Okay. Do we have any pain, pinching, or tightness in that direction?
No.
And then if we rotate out that way, no issues. So crazy mobility, which is good. That's always going to help us out with low back stuff. All this just feels like a stretch.
Mm-hmm.
Cool. No pain with that.
Mm-mm.
So kind of the same test we did before. I'm going to bring your knee straight and the ankle towards you. No issues in the low back there.
Mm-mm.
Same thing on this side. Are these like out of the box new
No.
shoes?
I mean, it's been COVID and I don't have a gym right now, so I just work out at home.
And no pinching in there. Well, that feels pretty good. What do you usually do for workouts?
Spinning, lifting, and yoga.
You said you've been out of it for a little bit.
Yeah, it sucks.
You kept a lot of that flexibility. Cool. Oh, that feels pretty good.
Mm-hmm.
Let's go ahead and flip on your stomach. So,
I can feel
you
that.
already feel that?
Yeah.
Okay. Is it more so on that right side that you're talking about?
Yeah.
Okay. It's very slightly rotated to that right, and we can almost see visually this right side has popped up a little bit more. Do you mind if I press into this area?
Nope.
Any issues with that?
No, I mean, I can feel it, but that doesn't hurt.
Okay. And as I'm kind of pressing into the spine, that feels okay.
Mm-hmm.
So coming out to the side of the spine, me pressing in on this right side versus the left side.
That feels pretty much the same.
Okay, so pretty equal from one to the next. Cool. Let's go ahead and both hands up to here, and let's push your upper body up, but we're going to leave this on the ground. Any pain with that?
I can feel it on my right side at the very beginning.
Okay. And then let's try to sink the belly to the floor a little bit more, and actually keep the handles, bring them up to here. That's okay? Okay, cool. Let's go ahead and sit on up. We're going to have a little education session.
Can't wait.
Bring out our spine guys. So, disc injuries, are you familiar with that?
Sort of.
Okay, so we have our discs. They sit in between the vertebrae, and those basically limit and support our movement. So, the lumbar spine, it's not really designed for a ton of movement. We only have like 2 to 3 degrees of movement here, versus the hips are designed for like 120 plus degrees. So these guys usually get overuse if we're bending over with the back too much. In this case, it sounds like it's kind of the straw that broke the camel's back. You already had some of this stuff going on, and then that quick movement to pick up your phone is kind of the onset of it. So it happens, our lumbar spine likes to be an extension. And so when we get too much flexion, so too much sitting or slouching, we create this flat spine, which puts a lot of the, I can't talk right now, it puts a lot of the pressure onto the front of the disc, allowing everything to come out to the back. So another example of that is this model. So if we're hunched forward or leaning forward, it puts a lot of pressure on the front, allowing everything to kick out into the back. So it'll create kind of this little tap onto the nerves. So for the other side, it looks like that. So my whole goal with adjustments is to create extension. So that was that last motion we did on your back. We're going to make that, or on your stomach, we're going to make that a little bit easier. That way we have a little bit more space for the nerves to heal. You don't have anything going down the legs, into the glutes, anything like that. It's pretty localized. And then you have a little bit of rotation that we can clear out as well. So on your right side, it's kind of the sacrum, ilium, we call this the sacroiliac joint, a little bit more locked up on this side. So we're going to adjust, kind of clean up some of the soft tissue issues that were there, and then recheck those motions, see how you feel after, and then focus on some little exercises that you can do on your own at home.
Sweet.
Sound good?
Yeah.
Cool. Let's go ahead and start face down. Do you have any questions with that?
No.
Okay. Nope.
I just want to feel better.
Yeah, that's the goal. And you'll be able to tell a pretty immediate difference. Like, you notice it with like your walking and sitting and standing, all that stuff. Like, if you walk out of here, you'll notice a difference.
Okay. If I walk out of here?
Yeah. So you said you have had adjustments in the past?
Mm-hmm. Only once.
Okay. You guys weren't working on anything specific?
No, I fucked up my neck.
Okay. Did it help?
Yes.
Sweet. The one and dones, those are the best treatments. Unfortunately, this is
Not a one and done.
it's not a one and done. And we can say that safely because you've had the same injury in the past, which even though it went away in the past, doesn't mean it, is necessarily not there.
Does it also have to do with my posture?
Yeah, totally. So, if we're always flexed forward or kind of in a spine flattened position, that's always going to be putting stress on that disc. So, anything that we can do to kind of reverse that. So I'm going to give you some exercises, some movements to do. Your yoga, honestly, like when you were doing that in the past, that was probably keeping you from coming in to see me.
Okay.
And so that's going to be my goal, is to kind of get you back into that stuff and kind of have you be able to heal this stuff on your own. Yeah.
Okay.
Did that explanation kind of make sense to you?
Yeah.
And none of this stuff is meant to be scary. I've got 2 disc injuries in my low back, and it's actually kind of a young person's injury. As we get older, those discs dry up and we don't have as much of that stuff going on. So I'm gonna put some pressure in right here. And are you okay with that?
Mm-hmm.
Cool. But yeah, when I get my stuff, I get zingers going all the way down my leg, and that usually is my cue to start getting back onto my exercise stuff. And do you mind if I press into the side of the hip here?
Go for it.
Okay. So this is our Piriformis. It is more a little bit lower. I'm going to glute medius and minimus attachment here. So we're going for that. That's going to affect our sacrum, and that was kind of that SI joint adjustment that I was telling you about. I'm like over explaining everything, mainly for the video, so you can tell me to shut up if it's too much. Alright. Cool. So when they adjusted you in the past, did they just look at the neck, or did they run through anything else?
They ran through my whole body.
Okay, so you're familiar with it.
Yeah, one of my legs was a little shorter than the other.
Cool. Yeah, and that's usually the case with most people. Another thing we can scare you with. Let's go ahead and face me on this side here. And you can lay your head right there.
On my side or on my back?
Yeah, you're perfect right there. So I'm going to bend this knee here. And I'm going to scooch you towards this side. And we'll rotate here. You can grab onto that elbow. And you're back in this position. That feels okay?
Mm-hmm.
Okay. So I'm going to do a little roll. I'm going to push right there. Great. Easy peasy. Let's go ahead and flip that way. It always sounds way crazier with the microphone on thing. So we're going to kick that bottom leg out. So kick that straight. Perfect. All kind of confusion.
I'm just going to be a rag doll.
That's perfect. Awesome. So coming up a little bit higher on this side. Great. And then let's go ahead. I might be sit up facing that way. This far. And then if we take the hands like that and bring them around the head there. And if we bring that, and big slouch. Does that aggravate the back at all?
No.
Okay, I got you. We're going to roll on back. Nice and relaxed. And then I'm going to take your hands. You're good on your back there. And bring your chin to your chest. Let all the air out. Perfect. Cool. Do you ever get headaches or anything like that?
Yeah.
Where do you usually get those headaches?
Like in my temples.
Temples, okay. No migraines or anything like that?
No.
Okay. So the temples can be a few things. Nothing behind the eyeballs.
Mm-mm.
Sometimes we'll get little referral sites for that. Little trigger points back here. Are you doing okay with that pressure?
Mm-hmm.
Kind of the good pain.
Mm-hmm.
Sweet. Yeah, TikTok's been kind of fun to play around with.
I've also just learned so much from it.
Yeah, somebody was telling me you can like look up recipes or like find movies on Netflix. And
Mm-hmm. Trying to think of my favorite TikTok hack that I've learned. I like cleaning videos, even though I'm not I'm a messy human.
Yeah.
And like deep cleaning's not really my thing, but I know how to get hard water off a shower head.
Wow. That's cool. I thought you were talking about like videos of people just like cleaning.
I mean, they are cleaning, but they're showing you how to like
Oh.
do certain things.
I guess anything with like a before and after is kind of satisfying.
Mm-hmm.
We do that with the chiro videos. You have to walk off the table and you'll be like, I'm cured. You doing okay with the pressure still?
Mm-hmm.
I think it's raining outside.
Dude, I left my house and I was like, I don't know where my raincoat is. I like never use it.
Was it supposed to rain hard?
No, I think it was supposed to. It was like 50 and 60 at 5 and 6.
Oh, okay. Yeah, I walked out of the house today and didn't even need a jacket. Kind of nice. Cool. So for the neck adjustments, kind of the same deal with what we just did with your other adjustments, just a little bit louder because that ear's right there. So
Okay.
I'll just stay nice and relaxed into this hand. Good. And a push.
Mm.
Awesome. And same deal here. Good. Awesome. Easy peasy. Let's run through Y strap. Have you seen this guy?
I don't think so.
Cool. So that's just a little traction adjustment. I'm gonna have you lift the head up. Good. And actually you need to take your hair. Good. So this will kind of feel through the whole spine. Are you doing okay with the skin
Mm-hmm.
on the cheeks and everything? And that feels pretty good?
Mm-hmm.
Okay. Awesome. And can you kind of point the toes down there? Good. And a little pull here. Alright. Doing okay with that?
Mm-hmm.
Awesome. Nothing too crazy. Were you able to feel that a little bit lower into the spine there?
Mm-hmm.
Okay.
I felt it in my lower back.
Okay. Nice, nice there. What's your band-aid?
I have this little mark on my arm that I've been trying to heal.
It's so relaxing outside.
No, it probably smells like rain too.
The best. Way better than snow. That last little bit of snow finally melted. I had it like outside the front here, and it looked like it was there for like 3 weeks. I was like, how are you still alive?
I've seen TikToks that talk about Colorado and those like ice patches of snow that just don't melt until like the very end of the season.
Yeah, I was like, it's 80 degrees outside and you're still doing. Close up a little tug here. Nice and relaxed there. Okay. Do you mind if I took a towel in right here and kind of pull this up?
Go for it.
Cool. So I want to do some scraping. Are you familiar with that?
No.
Let me get a towel. So if you look up real quick, I've got this guy.
Okay.
That has some little emollient. We're going to be just scraping onto the skin.
Okay. What does it do?
It basically, with disc injuries, we have the spinal component, which is kind of deeper, and that's touching on the nerves. That's what's giving us that sharp pain. And so we have a muscular component that will come with it, where muscles are basically get super tight, and that guards you or stops you from going into certain motions or directions that it knows it's going to be painful. And so secondarily, we can kind of get this pain coming from the muscles that's not necessarily like directly related to that disc. And so the way this works, we have little receptors that sit in the skin and the fascia, and those respond to either pressure or vibration. And so this tool is essentially just a pressure stimulus to get those guys activated. When those guys get activated, it sends a little signal to the brain sends a signal back to the muscles below to basically calm down or reset. And so I like to use it for the low back because we can hit a broad area pretty quickly. It comes from gua sha, which is Chinese medicine.
Dude, I just got one in the mail today.
What? Okay, so yeah, it's the same thing. It's gua sha.
Okay, cool.
The company that kind of blew it up in the States is called Graston. But now there's like thousands of companies that make their own instrument. But that's essentially what it is. It's a pressure stimulus. Gua sha, I think.
It's more like
I think it like
when
literally
training.
means yeah.
Oh.
So I think it literally means blood scraping, and so we used to think that this red response or petechia response, that bruising that occurred, is increased circulation going to the area, but we found in a recent study showing that only increased blood flow superficially, so to the skin and the fascia, and it wasn't actually getting to the muscles. Not to say that that's bad. It's just now we know that we don't have to go crazy with it to create all those crazy bruises and scars to get the same effect. So they found that if you go just as light, you'll get the same increase in range of motion and pain response effects. It's hard to quantify pain because it's subjective.
Mm-hmm.
So there's not like crazy amount of research on it. I use it because clinically I see really good results with it, and it's very, very quick. And for you just bought one online. It's pretty easy to do by yourself. So can't really mess it up. Like they've come out with like tons of different techniques and strokes and stuff. It's like, no,
cool.
all you're doing is scraping. You don't have to get too fancy with it. So awesome. From here, let's go ahead and pop up onto your hands.
Like that?
Yeah, just how we did in the beginning. And do you notice any changes with that?
I don't think I feel it anymore from right here.
Okay, and that felt pretty good for you
Oh, yeah.
regardless. Let's go ahead and stand on up and see if we can kind of recreate. Is when we did that forward bend. So we kind of started with the chin tucked and then all the way back down. That's when you started to notice it.
I still feel it a little bit right in there.
Okay. So not as far to the right, but more centralized now?
Yeah.
Okay, cool. Let's go ahead and come on up.
So is this gonna hurt?
No, it's gonna feel great. So are you familiar with acupuncture?
Yes.
Okay. So a similar needle, but a different concept behind it. So we say needle, it's more like a filament. It is very thin in diameter. What you should feel is kind of like a little muscle contraction. What you shouldn't feel is anything sharp or zingy.
Okay.
So kind of like a dull ache, unless we're in the right spot. So, you comfortable going face down again?
Mm-hmm.
So I'm gonna lift the shirt up again. And you were pointing to kind of like right in here.
Mm-hmm.
Does that recreate when I press in?
No.
And nothing up through here?
No.
Okay. Can you kind of point yourself to where it was?
I feel like it was like right there.
Okay. So we're right at
Yeah.
05. Okay. Sweet. So we're gonna get into the deep musculature there. It's called your multifidus muscle. When we do releases there, that can help to create more space between the vertebrae. And if we have more space vertically, that means that there's less pressure on the discs, so less of that disc kind of poking out and aggravating you, and more space for the nerve roots. So this is always my go-to treatment for myself whenever I have this stuff going on.
How long have you been doing the journey then?
I guess about a year now.
Okay.
So I always thought it was going to be something like really difficult to figure out, because acupuncture school is really far, but it's really just anatomy and then the concept behind it. You can feel a little poke here. Great. How we doing?
Good.
Nothing too crazy.
Mm-mm.
We just have one more. So same thing, little poke. There we go. All right, how we doing?
Good.
Fun little twitch response.
Yeah. That's wild.
But nothing sharp or painful.
Mm-mm.
So I've got this little stem device. We're gonna hook it up with some electricity. So have you ever had like a TENS unit or TENS pads?
Mm-mm.
Okay. So basically we're gonna feel a little heartbeat going on. That's just a little electrical stimulation. So I'm gonna turn this on. Let me know when you start to feel anything.
Oh, I feel it.
Okay. And I want it to feel strong, that contraction, but I don't want it to be painful. Can I keep going up, or is that good right there?
I think you can keep going up.
Okay. So you tell me when.
Oh, that's pretty strong.
Okay. Is that better there?
Yeah.
Okay. This device is extremely sensitive. So we're gonna hang here for a little bit, get those guys to contract and kind of reset that muscle. So with the Graston, right, that was a muscle release on a more superficial level. For a lot of people, that's really helpful. This is obviously much deeper. We hit the back of the spine, so the needles are actually on the bone, and that's where those attachment sites are for the multifidus muscles. So. But yeah, so in my old practice, I had an acupuncturist, and it was nice because I could have her go in and do the deeper needle stuff if I needed something more specific. But at this practice, it's just me. So I was like, I need to learn this stuff. And the stuff that she was doing, I was like, oh wow, like that'll probably take me a few years to learn. Like I'm sure they're not gonna get us into that. And it was like day 2 in my course.
Mm.
And we're doing exactly, the treatment that had worked really well for me. And they're like, yep, this is going to be your bread and butter. And it has been. It's been, this is pretty simple. I don't want to get too complicated with it, but we can branch out later if you're not feeling too much of an effect from it.
Okay.
Cool. So pulling the guys out here. Not too bad.
Mm-mm.
Cool. All right, let's go ahead. I'm gonna have you pop up onto your hands like you did before. And I want you to get a few press ups with repetition. So go ahead and bring your hands up to there. Good. And then go ahead, just get about 10 repetitions up and down. The reason we're doing repetitions is we don't have much vasculature going through the spine in that area, so it relies on kind of this pumping effect. So just like we did in the beginning, where I had that table going up and down, that's basically a circulation thing. We call it imbibition, is the way that we get nutrients going from vertebrae to vertebrae. So this is going to be your exercise.
Just push it?
Yeah. And so I really want you to focus on keeping this area completely relaxed and making connection with the table. So it's going to sound ridiculous, but I want you to shoot for about 5 sets of 20 a day. Thanks for watching. If you enjoyed the video, do me a huge favor and click on that like button below. And if you want to see more content like this, click on my face right here to subscribe so you don't miss out.
I just bought a new it. Spend a couple thousand just to cruise it. Shawty said she love me, but I swear she'll never prove it. I never tell her, but I put it in the music. Well, that's okay. All I wanna do is make